Hi, I'm Jean Schumacher, and I'm founder of Simply Plant Based, where I have a lot of programs to help you to change your health destiny, starting with the weight loss advantage, teaching you how to lose weight without dieting. It's awesome. And coming soon, very soon, is the pregnancy advantage, where we're going to help women who are either having problems conceiving or other women who want to get their bodies pregnant ready so they can have the healthiest child possible. And today I have Dr. Joshua Helman, former director of the Hippocrates Health Institute, and is currently with True North Health Center as part of their research team. He has 2 degrees in biochemistry. Wow, right there, that just kills me because, wow, that was the toughest course. So kudos to you for that. He earned his bachelor's from Harvard, magna cum laude, and a master's from the University of Cambridge. He's board certified by the American Board of Emergency Medicine and the American Board of Lifestyle Medicine. His medical degree is from Harvard and MIT. And as a plant-based physician, he embraces an integrative approach, including the importance of diet and lifestyle for optimal health. So, Dr. Helman, thank you so much for taking time to be with me here today.
Yeah, Gene, it's a pleasure. Thanks for having me.
Well, we are talking and diving into the coronavirus. Wow. Let's just jump right in here. How did this happen?
Yeah, so as we're jumping in, let me just say today is March 31st, 2020, and this is a relatively new process, and information is changing actually day by day, which is why I think that context is important. And actually, Gene, while we're talking, there's actually a presidential press conference on this very topic. So this is unfortunately very topical. And how did it happen? How did it start? My understanding is it started in China, in Wuhan, China, and we're not sure if it started in one of these markets with all these different animals, or I've also seen reports that there were virologist experts who were exploring bat caves in China. And so it either came from a market originally, or from a research lab. And hopefully, I mean, we may never know the origin, but those are the best guesses as we speak right now.
Well, how are we going to protect ourselves? I mean, I think we're all in quarantine, lockdown. So do you have any other ideas or things that we can do to protect ourselves?
Sure, and let's go over them. So it sounds like you and the people watching know the obvious things. Wash your hands, stay away from people who are sick, quarantine yourself as much as you can. Don't go crazy over it. One thing that they're not talking about, at least it doesn't seem to me, is sure, quarantining yourself it's going to delay you getting this virus, but unless you stay in a in your cave for the next couple years, at some point people are going to go out, and that people aren't talking about that right now. But the scary thing is that there are no established treatments as we speak. They're talking about, sure, maybe in a year we'll have a vaccine. That doesn't really help us right now. So let's talk about so right now the reasoning is, what, let's push this back. Let's give time for research. And by quarantining, you're preventing you from catching this virus right now, not unfortunately forever. So what, besides washing your hands, and I mean, one thing I think is reasonable is to wear a mask in public. And they have, I think strategically, because there's a shortage of masks in this country right now, unfortunately, they're saying, no, unless you're medical personnel, don't wear a mask. The thinking is that will allow more masks to be available for in hospitals and other healthcare places. So
what about gloves?
Yeah, I think gloves are a reasonable thing to wear when I'm examining patients. But I'm trying to think in public. Yeah, I think gloves would help too. It's either going to be gloves or wash your hands all the time. The tough thing with washing your hands all the time is, you can, if you wash too much, you can, cause cuts, and That's not going to be effective. And the other thing they're telling you is don't put your hand to your face. Good luck with that. I
I
mean,
know.
I mean, it's normal. It's normal. Hey, I've got glasses. What if I want to adjust them, etc. So sure, that's good to tell people. I'm just saying, realistically, even if you watch the news conferences with the president and other people saying, don't touch your face, and then they'll be touching their face. It's like,
Or my favorite was, don't touch your face, and then she licks her finger and turns the page.
yeah, it's like good,
Priceless.
yeah, good luck
Priceless.
with that. So yes, so there are, sure, the guidelines make some sense out there, and I think what we are seeing is a slowdown in the spread of this. But just to be real with the numbers that they're talking about right now, as we're speaking in the news conference, they're saying either between 200,000 and 2 million deaths in this country. I mean, that's awful. And and
Yeah.
they're and just like you're saying, yeah, quarantine. But to me, that's going to delay the problem, so that if for people who get really sick, you don't have hundreds of people going to the emergency room with respiratory problems all at once when there aren't enough ventilators. So yeah, so this is a huge tragedy, and yeah, it's not a fun topic to talk about, but it's really
Yeah.
important. So let's go over other things that people can do to prevent. The president mentioned azithromycin, and as an antibiotic that potentially can help prevent the virus, given along with chloroquine, one of these malarial drugs. And I would advise people, these are prescription drugs. You're probably not going to be able to get them on your own to begin with. And even if you find a doctor willing to prescribe, I can tell you, having been on the front lines in several states, my background's emergency medicine, and I've worked in rural emergency rooms, just in the last couple of weeks in North Carolina, in Pennsylvania, and also in Michigan. So I've got experience in a few different states. And what I can tell you is that these places they're taking it seriously. But I can also tell you, having tried to write a prescription for azithromycin, they're rationing it. So even if you could find a doctor willing to write the prescription, that doesn't mean that that you're going to be able to get those things. And so let me be clear, I'm not recommending people rush out and get the prescription drugs, azithromycin and chloroquine,
Well, do
because
they help?
yeah,
That's the bottom line.
and we don't know. I bet they probably do, but they do have side effects. They can prolong your electricity of your heartbeat. So yeah, so actually both of them can, and if you combine them, they can make the problem even worse. So, but I can tell you that azithromycin specifically, even though it's an antibiotic, it also suppresses the immune system. It's kind of interesting. So, and I think that's probably in the studies where it's having the effect, because azithromycin is good at fighting bacteria, but we're not dealing with a bacteria here necessarily. Now, I can tell you clinically, often when I see patients in the hospital, it's often not just one thing. They might have a virus and a bacterial infection. So, and again, I'm giving you these recommendations based on, it's not like we've had years and years and years to study this one
Right.
specific virus. But the good news is we do have, many decades experience with other coronaviruses. And we do, so another example, another thing that they're talking about for treating this virus is IV intravenous vitamin C, because we know that vitamin C has antiviral properties. The key is dosing it, and intravenously you're going to get a much better dose than orally, but I do recommend people get oral vitamin C. How can you get vitamin C? Well, one way is just to eat fruits and vegetables that have vitamin C.
That's the
I,
best way, right?
exactly.
Yeah.
And and there's a limit to how much vitamin C you can take in oral supplement form, because after a gram or two or three, it starts upsetting your stomach.
Well, isn't it water
So
soluble, so you don't store it, right?
correct, it's water soluble, which is, if you're treating yourself for it, you either have to be taking it all the time or getting IVs all the time. And I've worked in hospitals all over the country. IV hopefully the doctors on the front line can get IV vitamin C. I don't know.
Is it helping?
The limited studies I've seen from China suggest it's helpful.
Okay. Well, what
So
about zinc? That's
I
always
think
another one.
zinc is also known to be antiviral, and I do recommend people take a zinc supplement. Yes. Gene, normally I'm not a big fan of supplements,
Right.
but I think this is one of those circumstances where, yeah, keeping your zinc supply, high makes sense during this period. Another one that we know from studies of other coronaviruses is that nitric oxide. Have you heard of nitric oxide before? Nitric oxide it's a gas, but it's actually a biologically active gas. It's like oxygen, but the cells in your body use it in different ways. It turns out that nitric oxide stimulates your immune system and has been shown to prevent the coronavirus from replicating. So to me, that's exciting. And how would you get nitric oxide?
I was waiting for that.
Yeah. So just to be clear, this is not nitrous oxide. I'm not telling you to go to your dentist and get laughing gas. No, this is nitric oxide. One of the best ways to generate nitric oxide is to get green leafy vegetables and to chew them. And the reason you want to chew them well is you actually have your body has two ways to make nitric oxide. One is in the mouth and one is in the gut. So it turns out that if you don't, if you just inhale your green
Drink it
leafy
like
vegetables.
a smoothie. If you're drinking a smoothie.
Yeah, but with a smoothie, what you can kind of swish it before you swallow it. Mm-hmm. So it turns out because there are two different pathways, you want to maximize the amount of nitric oxide that you're getting. Again, you chew well, or if you've got a smoothie, you swish it before you swallow it. And then one of my favorite supplements happens to be Cardio Miracle, which promotes nitric oxide production. But again, whatever form you want to get it in, the key is you want to maximize the amount of nitric oxide you have in your body. No question. Yeah, Cardio Miracle is basically a supplement. Again, I'm not normally a big fan of supplements, but it's a supplement specifically designed with 40 different plants and vegetables to increase the amount of nitric oxide both in your mouth and your gut. And it's a powder, and you basically suspend it, and then you swish it before you swallow in order to maximize the amount of nitric oxide.
Well, where could somebody find that?
You can get it online. You can go to cardiomiracle.com. You can go to my website, drjosh.com. I think it's also on Amazon. Yeah, so there's a discount code on Dr. Josh. The discount code is Dr. Josh, DRJOSH. And normally I don't promote these things, but I know the guy who formulated it. He's ethical. There are other nitric oxide supplements out there. I don't think they work as well, but hey, whatever form you take, this is something that you should be taking on a regular basis. I like Cardio Miracle because it's long acting, and you want something long acting when we're talking about fighting a virus, because you don't know when you're going to run into it.
Well, I've been hearing some people, are knocked down, like somebody took a shovel and just, hauled off and knocked them in the chest and flat out, to other people who are so mild symptoms they don't even know they have it. So who's most susceptible, and why is there such a difference in reaction?
And again, I'm couching this because we don't have all the data on what's causing it. But my understanding so far is that, well, first of all, you're seeing different reactions because guess what? Different people's immune systems are different. And we are seeing, like with many diseases, that the elderly are more susceptible to it than young people are. So, but we don't know why that is. Just because you're old doesn't mean you're going to get sick. It could be that as people get old, they're more likely, especially in our country, if they're not eating plants, if they're not exercising, if their lifestyle is not good, they're getting chronic diseases like high blood pressure and diabetes and other things like it, which suppress their immune system. So in general, we know that this virus actually gloms onto what's called an ACE receptor, which is involved with blood pressure. We think blood pressure may be involved. But we're also seeing reports that the bad cases with the virus is what they call a cytokine storm. It's basically a whole inflammatory reaction that can be in the lungs and or in the gut. But it's not just those two organs. I've seen reports of it involving the heart too. So we are dealing with a unique pathogen, and there are also reports that it can specifically damage red blood cells. So
permanently or just
temporarily, but the thing is, it takes months for your body to generate new red blood cells. So unless you're getting a blood transfusion, which is why some of these are amenable to getting people hospitalized. But if the whole city goes to the few hospitals, unfortunately, and I can tell you that this is nothing new. We're working in emergency rooms in a dozen different states in this country, that we don't have the reserve capacity. And fortunately, this event is putting that into focus. Is like, maybe prevention, maybe keeping back some extra beds, etc., is a wise decision, because you never know the next disaster that's going to strike, whether it's going to be military or biologic or what have you.
Right. Well, stress, I mean, I just know, like myself, I've been locked down, and I pretty much haven't left except to go forage for food and groceries. And, I feel my stress, like, because you're hearing so much negativity and the stress. Is stress going to have an impact on this?
No question. Stress, let me be clear. Stress is not always negative. Okay. So, if you think back to our ancestors, if you're being chased by a saber-toothed tiger, it's good that you have the stress says, you know what, you better climb up that tree or get away. So, but what's not normal is stress that's long going. So I don't think, there's no question our ancestors had stressful times, but I don't think they had the pent-up stress every day, day after day, that people in our modern society have. And I would say in some ways it's even worse. So even though many people are not going to work, or their work is very changed, just the stress in being in a confined environment. And I know different people watching have different rules about, some people can only go exercise one time a day. Some people more often. In some parts of the country, like for example where I am now, the parks are closed. So great. So I'm going to go walk on the street, on the sidewalk instead of the natural park. So, but going back to your question, and your point is definitely true, that you need to do things to try to reduce stress. And I know talking, it's one thing to talk about it. We could do a whole talk just on stress. One of the things that I find very useful is deep breathing. It's just taking a time out, doing deep breathing. Other people like meditation. Another great one is exercise. And I get it. If you're used to exercising in a gym and your gym's closed, you gotta improvise. You gotta do something else. But there's no question that stress is a component in this. But the good news is, it's even though no one chose this situation, at least there are things that you can do about it. And if you don't know, talk to your friends or family, and come up with a plan.
Okay. What about sleep in this?
Sleep, from the studies, sleep is also very important for having a healthy immune system. So, trying to get enough sleep. And what is enough sleep? They say maybe 8 or 9 hours. Unfortunately, I run into people all the time who only get 4 or 5 hours of sleep, and you know, and they say, "Oh, I'm macho, I can do this." Yeah, maybe you can do this, but you're often doing it at the expense of your immune system. And it turns out that when we sleep, it basically the immune system and your brain basically flush out, and your stress level, etc., goes down. We're designed to sleep, 8 or 9 hours a day. We're not designed to sleep, 4 hours a night, long term. So.
Yeah. Well, is there any over-the-counter treatments? Like for example, I've heard Tylenol is good if you're going to, have a fever, not to take, things like Motrin, ibuprofen. What are your thoughts?
Yeah, so I think it's controversial, and I think it's important just to talk about it. So I personally try to avoid Tylenol and Motrin for fevers because it's my belief that when your body mounts a fever, it turns out that at the higher temperature, it blocks the replication, the multiplying of the virus.
Well, you're
So
creating an environment that's not hospitable to the virus.
exactly. So that's the reason for the fever. Now,
Right.
sure, if your temperature is 107 or 108, yeah, sure, take some things. But if it's a little bit high, I think unfortunately our society, maybe 50 or 100 years ago, in terms of pharmacists trying to push their products, oh, you've got a fever, your baby has a fever, take this, push this product. It's like we're designed to have a fever for a reason. We were, it's not like when you have a fever, it's a Tylenol or a Motrin deficiency.
Right.
So, so
Well,
I,
I also think too, like I know when I was a kid and I would get a fever and my mother would give me whatever, Tylenol, Motrin, whatever to bring the fever down. I would be like, hey, let's go out and play. My fever's down. And I felt fine. But in reality, your system is still fighting the virus. So,
exactly right. So yeah. So I'm not
yeah.
a big fan of Tylenol and Motrin. I mean, if that's what you need, if you've got a headache or something, sure, and you need to bring down the fever, but realize that Motrin is, or Advil is an immune suppressant, and if you're trying to fight an infection, that may not be the right thing to take.
Right. Right. Well, what about other things like alternative things like essential oils?
Yeah, so I'm a fan. I mean,
Mhm.
there there's literature on certain oils, certain essential oils like clove and rosemary and things like that being specifically antiviral. So and it's not just those two. There are probably a dozen different essential oils that have antiviral properties. There are also essential oils that help with stress, relieving stress. So
Absolutely.
so
Lavender, great
yeah,
one.
I'm
And putting in it
so
like 4 or 5 drops. I have a diffuser that sits on my nightstand, which puts some moisture into the air, and then 4 or 5 drops, of this. And I work with a company called Pure Haven Essentials, and they have a
okay.
blend called Tranquility, which, oh my gosh, like I'll put 4 or 5 drops of that before I go to sleep, and that just helps me have a very deep, very relaxing sleep.
That's great. Or you can add it to
Yeah,
if you're taking a hot bath, or you can
right,
rub it on your wrist. So yeah, so I'm a big fan of essential oils for those types of things. Sure.
right. Well, how do you cope with the stress around the virus and the poor economy?
Yeah. So and that's and I think that's the focus that the one of the focuses you see in DC is, oh, we're just going to print money and send every American $1,200, and this will get fixed. And I don't think that's going to work,
Yeah,
unfortunately. But you're right, it is extremely stressful, and so I think we just need to take a step back. To me,
right.
this is almost like a fast, realizing that it's time to put the pause button, maybe put your life, take a look at things and realize it's not just you, it's our whole society. And economically, this it's going to be like a depression. I mean, if people are not working because they really can't work, then this is on standstill. And sure, you can get stressed about it, but the reality is that, to me, the time that stress is useful is when you can change things about it. So you can change, you may have had a list of things that you wanted to do someday, or projects that you couldn't get to. This would be a great time to take that energy and devote it to those projects. But I
Well, I
don't have,
know
yeah.
my house is spotless. I mean, I have
Okay.
cleaned from top to bottom and got to those nooks and crannies. I've even like changed out my closets and, put my winter stuff away and brought my spring and summer stuff out. I mean, like stuff that would normally it takes me forever to do because I don't have time. I now have time. So I'm looking for the bright side of things. I just have so many projects and things that I'm doing. And that's keeping busy, I think, is one of the keys to not losing your mind throughout this whole thing.
But I think Gene, this is also part of history and humanity. Is like if you think back to our grandparents or great grandparents, I mean, they went through the depression. This is like the depression. Did they choose? Did they want? Was it fun going through the depression? I'm sure it was not.
No.
And
Yeah.
you can argue if it was, if it was caused by policy. It probably was, but once you're in it, there's not a lot you can do. Just like, were there things that China could have done to prevent this spreading to the world? Yeah, there is, but it's too late. The cat's out of the bag. Now we can get angry and upset and stressed about it. That's not really going to be very productive.
Right. Right. Well, what about diet? Is that going to have an impact on preventing this virus or dealing with the virus?
Yes. So the answer is definitely yes. It turns out that one of the things that your immune system is affected by is what you eat. So we just talked about if you eat green leafy vegetables, you're going to stimulate your nitric oxide, you're going to stimulate your immune system. Exercise does that too. Now, the other thing, and I'm sure you've had other speakers on this very topic, Gene, is that if you choose to eat animal products, because of the endotoxins and other toxins within
Right.
the milk and the eggs and the cheese and butter and chicken and beef and all those things, that your body is busy fighting those toxins instead of fighting viruses. And there are viruses even in chicken and things like that. So which is probably one of the reasons for obesity among people who eat chicken, but that's a whole other discussion too.
Okay. Well, what if I get it? What if I get a moderate or a bad case of coronavirus? What does it look like? And, what do I do?
Yeah, so unlike other viruses, it sounds like it could be respiratory, or it could meaning you have a cough and a fever, or it could be a bad bout of diarrhea, or it could be your heart and you could get short of breath. So here's what you do. If it's mild, like, yeah, I've got a little bit of fever, I'm a little bit achy, I've got a little cough, sure, you can call your doctor, but I would not run to the emergency room. And what I've seen in the emergency rooms I've worked in is they've actually started doing triage before you get even in the hospital. Basically, they're gonna they're going to decide whether you're even should go to the go within the hospital. The
Hmm.
tough thing in this country is testing. At least the places I've been takes a week or two. So by the time the test would come back, you're either going to be completely better or not, but it's not going to be helpful. Now, for people who are watching this, that may have changed, in the coming weeks. But right now, as we're talking today, rushing out and getting a virus test probably is not going to make a big difference. So I think the key is to have a doctor or a medical professional you can call if you're concerned. I mean, obviously, if you're super short of breath and or you can't keep down food or etc., then yeah, there are certain conditions where you're going to need to go to the emergency room. But what I've seen appropriately is people are not as much rushing out. Oh, I've got a little sniffle, I'm going to go to the emergency room now. So that right now you want to stay away from hospitals because I think that's a big risk factor in getting exposed to it.
Right. No, for sure. Well, I had heard somewhere along the way, and I don't know if this is true. Is there more than one strain now?
That's the report I'm seeing. But in terms of, I heard that maybe it's a more mild strain, but we don't know. I mean, in terms of trying to figure out how this came to the United States, my sense is a lot of it came through cruise ships. But it's possible when a month or a year from now when they look, it might be, oh, New York had a really bad strain, Detroit had a bad strain, but San Francisco wasn't as bad. So the other thing is they're saying that these viruses can't don't mutate much, but they're RNA viruses. So I don't know. Stay tuned. I think the reality is there probably are different strains, but
I
I
mean,
think
they
that
can't mutate?
I think they can. The question is, are they going to mutate in in the quickly?
Yeah.
And we don't. The initial reports I've seen is no, that they're optimistic that they can make a vaccine a year from now. But I don't know if you've ever had the flu vaccine, but often it doesn't really cover that. They have to predict in advance what viruses are going to be bad a year from now,
Right.
6 months from now, and normally it can change. So I'm going to hedge my bet and say we don't know. I'm sure there is more than one strain, but we don't know which one or ones. And often, the really bad, dangerous strains may not be spread because they quickly, incapacitate, and the people who get it, are deceased, and it's harder to spread. Except if you happen to be in a healthcare facility where the doctors and nurses don't have adequate protection, then unfortunately it is easy to spread. So,
Yeah.
we unfortunately we don't know yet.
Well, if you do get it, what about fasting? Just going to bed, pull the covers over your head, drink water.
Yeah, so I think that makes sense. I mean, if you look at animals in the wild, when they get sick, their normal response is to fast. So, but I'm not suggesting that people, if they think they get the virus, they should go on a 5-day water fast. I'm not recommending that at all. Just because you're going to need your immune system, but I don't think there's anything wrong with drinking plenty of water if you end up catching this virus.
All right. Well, Dr. Helman, thank you so much for taking the time and sharing your knowledge and wisdom with us about this global pandemic.
Thanks, Jeannie, and I wish you well, and I wish everyone watching this.
Yes.
I hope this this becomes history quickly, and we can move on to other issues.
But in the meantime, stay home.
And stay healthy.
Yeah. All right. Thank you so much.
Thanks, Jeannie.